Hello, my name is Marcos Ewing. I am a respiratory therapist here in Tucson, Arizona. This is for my gender-based medicine assignment. So today we'll be going over the differences between sex and gender, as well as the challenges that these differences create for us healthcare providers. I'll be specifically targeting other respiratory therapists, as well as maybe students, RT students who are going into the field. I'll be specifically targeting other respiratory therapists, as well as maybe students, RT students who are going into the field. So we can start off with the differences between sex and gender. We'll start with sex. So sex by definition refers to a set of biological attributes. It's decided by our chromosomes, our reproductive organs, hormones. It's determined in utero. Essentially, we're born with it. In school, we learned that as far as chromosomes are concerned, women have an XX chromosome, and the males have the XY chromosomes. When it comes to gender, it refers to the socially constructed roles by society. It's one's, I like to call it, personal identity. Someone can, choose what they choose to identify as, or essentially how an individual perceives themselves to be. There are also biological differences, as I mentioned. As far as women are concerned, as far as hormones, they produce estrogen, whereas males produce testosterone. So why is this important? So understanding the difference between sex and gender is important in healthcare, especially because we always want to, first of all, be respectful to our patients and be conscious of their feelings. And also, we want to make sure that we're giving them the proper care and treatment. There are different values and types of medications specific for women and men, so we want to make sure that we know, the correct sex of the patient that we're dealing with. Going to be giving an example of this in the form of a skit, just to kind of go over in a scenario that I've kind of witnessed where the differences between sex and gender kind of got in the way as far as dealing and caring for the patient correctly. So, hello, doctor. You asked for me? Hi, Stacy. Yes. I called you in here. I was wondering why this pulmonary function test data is all out of parameters. I was examining the data and it seems you have entered the wrong sex for the patient. Yes. I was a bit confused when calling the patient, as I called for Mrs. Smith and a gentleman walked up. I made sure to say that I was looking for a Mrs. Smith, and they confirmed that this was them, and that they identify their gender as a female. I assumed I was supposed to enter the sex she told me. Was that not right? So I do see the confusion, but we need to make sure we are putting the appropriate sex of our patients, especially when performing testing. Sex plays a large part in the results and parameters as they are different for both male and female. The normal values for a male doing a PFT are going to be different than a female doing a PFT. And you want to make sure that you're putting the correct sex no matter what the patient identifies their gender as. Well, aren't sex and gender the same thing, doctor? They actually aren't. Sex refers to the biological differences in male and female. An example would be their reproductive organs as well as hormones. Gender, on the other hand, has more to do with social and cultural aspects. A person can choose to identify as a different gender, and this can fluctuate as the individual chooses to. Oh, okay, got it. This is why, even though Miss Smith was born a male, she chooses to identify as a female. And when doing testing, I will make sure to enter the correct sex for patients so that the results may be accurate and we can treat them accordingly. That is correct. Thank you very much. Now get back to work. So just kind of a quick overview of the skit. So I work at a pulmonary clinic. We do specialty testing there. One thing we do is pulmonary function tests, PFTs, and so they do a lot of different kind of breathing and exercises and things like that. And we get a lot of data and graphs that the doctor can interpret and go over with them. But if these, we enter sex, race, height, weight, if they're... So in the skit, it kind of brings up a good point that maybe sometimes as healthcare professionals or businesses, we don't we need to take maybe some measures, different kind of techniques as far as making our patients feel comfortable, because that whole situation with Stacy and the patient, I'm sure was very maybe uncomfortable for the patient, or even a little bit awkward for Stacy herself, to kind of have those conversations. So I think we need to kind of implement a way where we can let the patient's gender, or let them have a secure, maybe private, more type of way for them to let us know their gender. Oh, a way I was thinking is, before we get new patients at our job, they have to fill out new patient paperwork. I feel like there should be an area or some type of designated spot for them, for sex and for their preferred gender, their preferred pronouns, so that way before these instances like in the skit can not happen, and we can avoid those situations because we already know what the patient prefers to be called and what they choose to identify as. I also think that maybe as part of training, the training process in healthcare facilities, there should be some type of educational course implemented as far as understanding and going over the differences between sex and gender, and why it's important for our patients and important for us, so that we are able to properly treat them. So this lack of knowledge negatively affects our patients, both male and female, because it poses risks. It creates this discomfort with the patient. They probably won't feel comfortable at that point sharing information with you, or getting the proper treatment that they need, because they don't feel comfortable with the staff. And these types of situations don't happen very often, but when they do, I think it's important that as any respiratory therapist or any other medical staff, we have that knowledge behind us, and we are feel comfortable and confident moving forward and going with it. It's already tough enough in a way to be to deal with patients and to deal with family members and things like that. So to kind of throw this issue of gender-based identities and things like that into the mix kind of makes it that much harder. As respiratory therapists, we're with our patients for a good amount of time. Usually we see them a few times a day, so it's important that they feel comfortable around us, and we feel comfortable not breaking any barriers or offending them in any kind of way just because of our lack of knowledge. So I believe it would make the patient feel more comfortable knowing that their information is private, and they feel comfortable around the doctors and the staff. So thank you for watching my video. Thank you for allowing me to go over the differences between sex and gender and how it relates to the respiratory therapy and handling our patients and providing adequate care. And yeah, hope you enjoyed it. Thank you very much.